Hello, Montgomery, Alabama. Always wanted to be a rock star. Here's my chance, right? Hello, Montgomery. Hello, Edmund. You know, I have to do it for everybody. Hello. Yeah.
Okay, I am just going to give it like one more moment and then we can get started here. And thank you everyone for all your warm hellos, very good vibes entering into this webinar today.
Oh, sorry.
Okay.
There we go.
Okay. All right, well, I will use this opportunity to get started. Hello, everyone, and thank you so much for joining us for the 2023 School Mental Health Virtual Learning Series. Our topic today is individual well-being, school staff wellness, and self-care. My name is Cameron Sheedy. I'm a research coordinator at the National Center for School Mental Health, housed within the University of Maryland School of Medicine. And I'm going to briefly present some introductory slides before I pass this off to Dr. Kris Scardamalia, who will be presenting today's session. Okay, so to start with some technical information, these slides and recording from today's webinar will be posted within about a week on the NCSMH website, which is schoolmentalhealth.org. Please use the chat box to respond to what you're hearing and learning, access resources and links that may be sent, and provide more general comments, as many of you are already doing, so you are familiar with that. Type any questions that you have into the Q&A box, which you can find by going to where these arrows are pointing on the screen. We can't guarantee that we'll get to every question, but we will absolutely do our best. If you have any technical issues, please message hosts and panelists through the chat box, and one of us will do our best to help you through whatever issue you are having here. And finally, continuing education credits will not be offered for today's session, but we are still very excited to have you with us, and we're very confident that you will learn a lot and be happy to have joined regardless. Certificates of attendance will be available for today's session, and I will explain more about those on the next slide. And let me just, okay, for some reason the caption is closing, but that's okay. Okay, so for the first time of this year's virtual learning series, we are offering certificates of attendance. So in order to receive one, you will need to follow the relatively simple process, which is outlined here. First, you'll need to complete the post-webinar evaluation, which we will start sending about 45 minutes into the webinar, and we'll continue to send you several times throughout. Once you've completed the evaluation, you'll be redirected to a certificate request form where you will be asked to submit your name and email address. Once you've done that, that's all you need to do, and you can expect to receive your certificate within about 30 days or so from today's date. Just some quick notes to keep in mind. In order to receive the certificate, you must have attended at least 50% of the webinar, which is tracked through Zoom. You must also attend in real time, meaning you must be here with us right now. Unfortunately, if you are planning to watch the webinar at a later date or time, you're not eligible for the certificate of attendance. Secondly, your Zoom name must match the name that you registered with. So if you're currently in a group or you're only using one computer to watch this webinar, we recommend at least logging into the webinar with a separate computer on a Zoom account that matches what you registered with. So at least log in and you can still watch together, but make sure that you're, kind of counted here in the webinar right now. Also, if you're dialing in, please email. We're basically going to need to cross-reference that your phone number matches the email address that you registered with. So please just email me @csheedy at the email address that's provided here on the slide, and it's also going to be dropped in the chat. And just confirm that you're present at today's webinar and provide your phone number that you called from, and we'll make sure that you can access your certificate. Finally, the last note to mention is that when you click into the evaluation after the webinar, you'll be asked a couple of somewhat personal questions, like the last 3 digits of your zip code, 2 digits of your birth year, and so on. If you see this and think, I don't want to put in all that information, and then just simply click out, we completely understand that instinct. But I want you to know right now that you don't actually need to put in, that factual information. Nobody is going to be cross-referencing that. So all you need to do is put in digits and numbers that you can remember and that you're comfortable with. Like if you see on this slide here, I put 1, 2, 3, and for the letters I did dog. You can do any 3-letter word that you're comfortable with. So just make sure that if you do want to do it that way, that you write down the code, or that it's something that you can easily remember, because you may be asked to use the same code another time when you're going to complete these evaluations. So with all of that said, please take a moment to introduce yourselves in the chat box. Please include your name, your role, and where you're joining us from today. And also, why is this topic, individual well-being, school staff wellness, and self-care, important to you? And I'm going to give everybody a couple of minutes to fill that out.
All right. Good afternoon. I'm going to talk while you're filling that out.
Okay. I still have the other intro, but we're almost through with that. Okay, we just have a couple more slides to get through. So I will do that while people are introducing themselves. Okay. So while you all are introducing yourselves, I just wanted to quickly show you all the staff who make up the Central East Mental Health Technology Transfer Center Network, or MHTTC for short. The Central East staff has extensive experience working in behavioral health. The Danya Institute is led by Oscar Morgan, and our school mental health lead is Dave Brown. You can also see the University of Maryland School of Medicine team who supports this project to the right here. Just wanted to note that it's the Danya Institute who will be collecting your evaluations, and we really appreciate your participation in those. For a little bit more context, the Danya Institute is funded under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. Central East, or Region 3, includes these states listed here: Delaware, Maryland, Pennsylvania, Virginia, and West Virginia, as well as Washington, D.C., which is relevant because I wanted to also take a very brief moment to invite our Central East region friends and partners to participate in our upcoming learning community on promoting school well-being. Our plan is to run 2 learning communities, one for school staff and one for school and district leaders. Our goal is to have the first session at the end of this month, so just in a couple short weeks, and then host 1 session per month through June. If you're interested, please fill out our brief interest form via Qualtrics, which was just dropped into the chat. And if you have any questions, please email Miranda at the email address provided here, and we can make sure to send this information out to you after the webinar as well. But we hope you'll consider it, and we hope that you might join us for our learning community. In terms of Central East MHTTC, they strengthen the capacity of the behavioral health and primary care workforce to deliver evidence-based practices for prevention. Whoopsie daisy, something happened there. Okay. Central East MHTTC, they strengthen the capacity of the primary care workforce to deliver evidence-based practices for prevention, treatment, and recovery support to individuals who have or are at risk of developing a serious mental illness and or co-occurring substance use disorder in Region 3, which I just explained on the last slide. This slide also shows the specific actions addressed by the Central East MHTTC at the Danya Institute. And here we go. The National Center for School Mental Health at the University of Maryland School of Medicine is funded in part by the Health Resources and Services Administration to lead the National Quality Initiative on comprehensive school mental health services, and is focused on advancing high quality, sustainable, equitable, and comprehensive school mental health systems. We are led by Dr. Nancy Lever and Dr. Sharon Hoover, and the center comprises the wonderful faculty listed here, as well as a lot of other amazing staff and clinicians. At the center, we are committed to conducting all of our work through a racial and social justice lens. We work to support culturally responsive and equitable practices in school mental health, with a specific focus on Black people, Indigenous people, and people of color. We also recognize that through addressing structural and systemic inequities long present in education and healthcare settings, school mental health systems have opportunities to develop and model equitable and anti-racist policies and practices. Ultimately, we are committed to learning, healing, and growing together, which is in part why we are gathered here today. And thank you again for joining us. Finally, this is the last slide for the intro. The Central East MHTTC, in collaboration with the NCSMH, is hosting the 2023 School Mental Health Virtual Learning Series. And our objectives for the series are listed here. They center around increasing understanding and support for trauma-informed, strengths-based, culturally responsive, and equitable school mental health services and supports. Something is happening with our tech today, but we will get it figured out. We currently have webinars planned monthly through May, and we are going to, based on feedback from last webinar, we're going to continue that through June. So yes, we look forward to seeing you, and we look forward to continuing this webinar series. And with all that, I'm going to pass things off to Dr. Scardamalia, who will be leading the rest of the session.
Thank you, Cameron. I super appreciate it. And thank you, everybody, for joining today. I know for many people, this is your spring break or the week before spring break, but definitely a time when you have things going on. I'm sure I can say that about most of the school year, but I really appreciate you logging in and joining these learning sessions. I will kind of prompt again for that learning community. One of the things we'll talk about today is community and social support is such a big part of caring for ourselves as educators. So if you're able to join one of the learning communities, it's a great way to get some group support and to not feel like you're the only one who's working through some of these. So as you can see on here, I am Kris Scardamalia. I'm an assistant professor at the University of Maryland School of Medicine and work with the National Center for School Mental Health. And you see just a little bit about my lens that I join with today. I am a white cisgender female. I use she, her pronouns, non-religious, middle class, and non-disabled. We try to always talk about what our lenses are because certainly that impacts my perspective and the way that I view information. All right, so I sort of feel like we can cap off the last several years of everything we've gone to, right? Oh, when life gives you lemons, it's like, yeah, well, what happens when I have yet another metric ton of lemon and no need for any more lemonade or lemon bars or lemon meringue pie or anything else you can possibly think of to do with lemons. So what is well-being? You know, we often jump into this topic, but maybe not having the best idea of what we mean. What we don't mean is to be happy all the time. We have no stress in our life. Everything is just coming up roses 24/7. Life happens, stress happens. Well-being is when we're able to kind of surf that, ride it, rise to the demands, and not be ultimately crushed by what's going on around us. So well-being is not simply the absence of stress or negative feelings, but it's good health, it's happiness, it's being satisfied with your life, having a sense of meaning and purpose, and feeling that balance of positive emotion and then the stress or challenge that's naturally going to come along. What that means for each person right? What gives you a sense of meaning or purpose, or makes you feel satisfied with your life, your job, things that are going on. This is very individual, right? This is where a lot of cultural overlay comes into play. What happy is may not look the same for each person. And I mention that because a lot of us are here for ourselves today, but I also saw a lot of mention about wanting to support staff and employees and other folks. And so when we think about what happiness looks like, what well-being looks like for other folks, we have to remember it's not always going to look like what it looks like for me. And the things that make me happy and that I think are important for everybody may look differently for the next individual. So self-care, right? It's not just doing yoga and taking hot baths, although I'll do as much of that as I have time for. It might also look like saying no, taking a step back, taking a break, putting yourself first, asking for what you need, right? Even in school environments where often what we need isn't super available, but setting those boundaries and saying, this is what makes life and work doable for me. And when we say doable, like, can you come back tomorrow and next week and next school year, right? Thinking about education as a marathon, definitely not a sprint. Couple resources for you. These are very similar. The top one here is the TeacherWise Wellbeing Workbook. This is downloadable as a PDF if you like print materials. It has also been adapted to an online platform if you prefer to move through things on some self-paced modules. So the one on top here, the TeacherWise, is really geared for classroom teachers. We've also included the other well-being resource on the bottom here, the provider well-being. Very, very similar material, but intended for behavioral healthcare providers. I include this here because we find that school mental health clinicians, they sit right in between the two, and sometimes the provider well-being speaks a little more to what our school mental health clinicians are working with every day. The big difference is whether we're talking about a client session where we're working kind of one-on-one, or whether we're talking about classroom environments where you are most of the day. So the model we're going to talk about today is sort of this circular process, right? Because we're never really done checking in with ourselves. We want to cultivate some awareness. Where am I right now? Am I getting a little burnout? What's going on with me? Do I need to engage some other coping strategies? So cultivate some awareness, taking stock of what all that means. I'm going to make a plan. I'm going to practice with intention, and I'm going to refine my plan. As we get into this material, I know that we did a very similar webinar about 2 years ago. And so this first part is going to be a bit of a brief overview on some of the nuts and bolts of compassion, fatigue, burnout, self-care. If you want more of that, you can go back to the same webinar page where you registered for this one. And if you scroll down, our prior webinars are on the bottom of that page. And the one from November of 2020, we really sort of dig into a lot of those foundational building blocks. So we're going to do some overview of that, and then we're going to get into how do I improve my well-being. All right, so cultivating awareness, understanding how stress manifests for us, right? Because sometimes we think, I just need a good night's sleep. Spring break is here or coming up, and be on spring break and I'll be fine. And if we're not really attending to how our body's reacting, we can often miss that this isn't, I need a good night's sleep time. This is, I'm sliding full on into burnout time. There's the musculoskeletal things, right? We get lots of headaches and tense muscles. The twitch beside your eye that doesn't stop, that's stress. Grinding our teeth, even things like stammering. If you're usually somebody who speaks pretty smoothly and you find yourself like having a hard time finding words, stammering over your words, stuttering a little bit, those can be signs that you are in a pretty stressed out place. Lots of stuff going on with our central nervous system. So stomach upset, sweating, dizziness, insomnia, sleep, right? Just not, maybe you're even able to sleep hours, but it's not quality sleep, or you're not even able to sleep a reasonable number of hours. Mood and demeanor, this is something we often don't recognize. I think we're a lot better at, my shoulders hurt, and this is where I carry my stress, and I have all this physical stuff, and so I know I'm not doing well. We often blame ourselves when mood and demeanor starts to become the signs of our burnout, our compassion fatigue. This can look like being preoccupied, being forgetful, being very anxious, being very edgy or irritable, kind of loss of hope. Nothing's working out. I don't know what anything, what anything means or where anything is going in life. These come along with burnout and compassion fatigue. If you find yourself feeling fairly negative about your job, wondering what it all means, if it's, worth doing anymore, you find you're constantly forgetful, you're irritable with others, instead of taking all of that and saying, oh, maybe I'm not well suited to this profession, we can take all of that and say, oh, this profession is stressing me out a little bit right now, and I need to engage some of my coping strategies, and to not internalize that as I am just not meant for this. To help you do that, we have some resources for you. There's lots of others that you'll find out there. One of the things that we like is it's a very basic stress reaction log. Everything I have in here, I try to make as easy and checklisty as possible, because the one thing we don't need is to make any sort of well-being supports yet more work that I do not have the time and energy for, right? So this is just simply a Word document. On each day of this tracking system, you just do a stress rating. A 1, I have no stress at all, and a 10, this is the most stressed I've ever been. Give yourself a rating, and then on the full sheet, you'll see every symptom that we have listed out for musculoskeletal, visceral, mood and demeanor, and just simply check which ones you experienced that day. Give it about a week or two, and you'll start to have a good sense of, oh, when this happens in my body, I know I need to start engaging some extra strategies. You can also get a measurement of your compassion fatigue, your burnout, your secondary traumatic stress. This is on the Professional Quality of Life website. Free, downloadable. It's a 30-item self-report. You score it on your own, and you'll get an overall score for compassion fatigue, burnout, and secondary traumatic stress. And we go into this quite a bit in the previous webinars about how understanding what's coming up for you can really help you align interventions for yourself. All right, so I'm aware that my muscles are tense and my eye is twitching and I'm not sleeping. Yep, I got that, right? I'm aware. But what is it that's really going on with me? So there's a time to start to take stock. Some of the guiding questions we have here, right? What is lightening my day right now? What's happening in my day that I go, oh, I feel a little bit better? What's making me feel heavy in my day right now? What am I avoiding? What's making me anxious? What's prompting my mood or energy changes, right? When you see that drastic change, what just happened? Or maybe thinking about, we kind of use the magic wand way of thinking. If I could only change one thing, what would I change? And when we limit ourselves to that one thing, that magic wand kind of forces us to start thinking about, well, if I change this, it doesn't really change anything else. But if I change this over here, well, that would change this and the next thing and the next thing. So where is the thing? What can I change? It's going to change the most things overall. One of the tools that we have for this is called the PULIS Stress Inventory. This is adapted for teachers, and there's some classroom questions here. There is a similar inventory in the provider wellbeing package. And what this does is it starts to break down where our stress comes from in schools. So is it students and their behaviors? Is it just the teaching profession itself? We've certainly heard that talked about quite a bit over the last few years. Is it the specific location where I work, the school building that I'm in? Is it the overall workload? So again, this is a very brief self-scored, self-assessment. And you kind of see, what is it that's kind of getting at you? When we do these live in person, there is always at least one person who says, I really thought it was the students. Like I would have told you all of my stress is coming from the students. They do this and they're like, oh, I'm actually quite stressed out about other things, and students were my lowest score. So this will just kind of give you a sense of the area, the relative area that your stress is coming from. All right. So we have a sense of where we are. We've taken stock. I know that it's the workload and some of the impressions about my job at the moment that are really, really starting to stress me out. So I need a plan. I've got to, it's not going to just sort of get better on its own, right? I've gone into this process with intention, so I need to make a plan. And even if it's just me tracking me, making promises to me, I'm pretty easy on myself and I let myself get away with things. So write it down, right? Really try to increase your accountability. Share this with somebody else who can help keep you accountable. So you can't just go, oh, it's okay, I give you a pass. Me, okay that you didn't meet your goal for the day, right? I need to tell somebody else I didn't meet my goal for the day. Start small, start 1 or 2 strategies. It's too much to do 3, 4, 5, 6 big changes, right? We want to start with something that we know is doable, that we can manage. Be okay with scaling it back. Sometimes we do really out of the gate, really go for it. And sometimes that we need to step back, okay, that ended up being a little too much, but I can do this piece of it. We want to track our progress, like I said, engage our social supports, maybe do this with somebody and celebrate every success, no matter how small. Yeah, let's get things going. All right, so again, writing it down, the other resource here is it's a very simple worksheet. If you really have a clear idea of what you want to do, you can just write your 2 goals down. If you're kind of sorting through it, there are some guiding questions that can be helpful. What changes do I want to make the most right now? What are the most important reasons for those changes? What steps do I plan to take? And what could interfere? Sometimes pre-planning for what can go wrong helps us not be quite so flustered when that thing happens and then it puts everything in disarray. It's like, oh, wait a minute, I knew about this, I planned for this, I'm ready for this. And it helps make sure that we don't get derailed by things that were pretty easy to say, oh, this was going to happen, that was going to happen. All right. We also, the second half of what we do today, which is why we're pushing a little quickly through the beginning part, is different ways of working through our stress. We're going to talk about it in 4 different categories, but this is an inventory here that if that strikes you, you can use this. Again, it's a self-report and see where your coping strategies mostly lie within these 4 categories. All right. And what is the most stressful thing or the stress reaction you would most like to change? So we've written our goals, right? We're practicing with intention every day. We do want to make sure though that we've got for the right goals, the right strategy. Do I have control over the thing that I want to change? Right? Am I making goals that I have 100% control over? If things aren't going quite the way you planned, this is a good first question to ask, right? How much of this is under my control? What aspects of this can I impact? What bothers me most? And what do I have the energy to actually tackle? So as we're practicing with intention, right, we're taking note of what's working and what's not, because we're trying things out. And maybe a strategy really works super well for me, and maybe a different strategy doesn't work super well for me. But I don't know that unless I'm really attending to that. So one of the other resources we have to offer is just the self-care plan rating, very similar to the symptom tracking that we had in the beginning. But every day you're going to do a rating of whether you feel a little worse, a lot worse, a little better, a lot better. So you'll see on the second line there where it says used CS. It's just, did you use a coping strategy that day? And you rate yourself from a -2 to a +2. At the end of the week, do I have mostly positive numbers? Do I have mostly negative numbers? And then we can use that feedback to refine what our plan is going to become for the week and the months after that. Right? So this was the opportunity to reflect. Was the plan ultimately feasible? Was there a better way to tweak it, to make it more feasible? What did I like? Did I get the results I wanted? What were the surprises? What do I want to keep? What do I want to get rid of? We should not be afraid of, oh, I see questions about links to last report. So some of these resources that we have are documents that go within the curriculum. And what I'll do is attach those documents to the PowerPoint that will be posted in about a week with the recording. So all of those will be available essentially as attachments to this. So what gets in the way, right? This all sounds very lovely, very easy, very lovely, but let's talk about what gets in the way of our well-being, because this is really sort of the meat of what we're dealing. We've got a couple different categories of things here. But moral injury is sort of the first one I want to talk about. This is something we're talking about more and more in education after all of the impact of the last 3 years. Moral injury is a concept that comes out of the military. And then we first started seeing this talked about a few decades ago with soldiers returning and folks who have had to engage in behaviors that we don't typically engage in every day, right? And we don't even feel good about engaging in. And how do I handle that I had to, for my job, I had to do things that I wouldn't have done in my personal life. So this is moral injury. With a lot of what's gone on over the last few years, we're seeing more and more educators really struggling with this. Right? This is a deeper injury than I got yelled at today. I wasn't, happy with this new program that we brought in. This is sort of a deeper, more pervasive, taking stock of how I feel about being in my profession and doing what I'm doing. So moral injury happens when you have to do something that goes against your beliefs, or you're not able to take an action that would have been in line with your beliefs. When you experience a betrayal, whether it's of action or values, right? So it may be that somebody did or didn't do something. It may also be a betrayal of value from leadership. But this is from leadership or others in positions of power, where you start to feel betrayed by those that you had trusted as leaders and in authority. And that when we're experiencing moral injury, we can experience a lot of guilt, shame, disgust, anger. Like we can start taking it out on ourselves. And we can often experience this very vague sense of dissatisfaction and discomfort, right? Because it isn't the single thing. It's not something that you can sort of grab onto and say, this is the problem. It's this kind of just squishy, sort of pervasive. And this is where we find we're just struggling with our environment and with what we're doing. So it's good to kind of, as we walk through some of this, you might even go back to one of the self-inventories we had around self-care about my sources of stress. When we start to see things like the teaching profession itself that pops up to the number one concern, then we have to start asking, what is it about being an educator? What is it about being in education that's really a struggle for me right now? Which all leads to defensiveness, right? Whether it's moral injury, whether it's being overworked, whether it's being tired, whether it's being stressed out from a billion other things everybody has going on in their real lives outside of work, right? Defensiveness is a super easy place to drop into. We tend to talk about defensiveness as if it is a character fail, right? That it's oh, this person is just so defensive. And it's a real negative. None of us want to be called defensive. Defensiveness is simply our reaction, our very predictable reaction to not feeling psychologically safe. That's it. When we think about not feeling physically safe, right? If I'm in a situation in a dark parking lot late at night, I hear a noise, I don't feel physically safe. First thing I do is I tense up, right? I tense up, I maybe start walking faster, I may be running to my car, I'm getting out, whatever sort of, if I have pepper spray that I carry, I'm doing all of these things, right? I'm getting ready to physically confront something. Psychologically, it's the same thing. When I'm not feeling safe psychologically, defenses go up, walls go up, and I'm now ready to start defending myself, not physically, but emotionally and psychologically. What sorts of things tend to evoke these defensive reactions, right? If I feel like I'm being blamed, if I feel like a judgment is being made about me, if I feel like I'm a bad person or I'm being perceived as a bad person, right? Defenses go up. If I feel like I'm undervalued, anybody in education ever feel that way? That what you say doesn't matter, that you're undervalued? that you will look silly, or that others will think that you're stupid or that our value is diminished. For anybody who works with our adolescent age, right, this really, really comes up with our teenagers, that they will do anything to not look silly. So if you find yourself, or you're talking with somebody who seems to be in a very defensive posture, you're in a very defensive posture, the first question to ask is, what is making me or the other person feel unsafe? Because something is coming up. It's really crucial to remember that just because the defensiveness is being directed at you, it doesn't mean you're the one who made the person feel unsafe. Right? They may have just had, a big old fight on the phone with their partner, and then they're walking in for a meeting with you. And whatever went on the fight on the phone has really got defenses up, and they're very stirred up, and they're really feeling very blamed, and like some really unfair things are being said, right? All of this comes into the meeting with you. You're like, whoa, what's happening? But if we can step back, we can read the defensiveness, understand this was what it was walking in the door. We can still take a minute, help that person relax for a second, understand what it is that's got them so flustered, and try to return a sense of safety, at least in that space. All right, so as I get to the what do we do about being defensive slide, right? Reducing the perceived danger. That's why this is bold. There's all of these other things are just ways to reduce perceived danger. You can reframe, if you're making a request, reframe the request, or the behavior that you're talking about. Again, anything that feels blamey, targeted, nitpicky, right? So I'm asking you to do some things. I'm asking you how to make it easier to do these things. Asking questions rather than making statements, being more open, and treating people as equals, giving other folks grace, giving ourselves grace, knowing that we're not always having our bad days. Other people are always having our best days. Other people are not always having their best days. And taking that pause to say, whoa, I don't know, things kind of got off on the wrong foot here. Can we start over? Can we talk? Can we, I really want to help problem solve whatever it is that's going on that have brought you two together. And keeping track of what I can control and what I can't. And we mentioned back in the beginning here, right, are the strategies that I've chosen, or the things that I'm focusing on, are these things I can actually control? There are few more frustrating places to be in life than trying to change something that you don't have any actual agency over. So you're just, right, we're just, who is it, rolling the rock up the hill, right? Every day, because you don't have any ability to change this thing, and yet that's where your focus is. So you have no ability to change the past, the future, what other people think of you, what happens around you, how other people take care of themselves, what other people think of you. What we can control, our boundaries, our thoughts and actions, the goals that we set for ourselves, what we give our energy to, what we choose to engage with, and how we handle our challenges. If we find that our goals are really sort of focused on that outer ring, the out of my control, we have to ask ourselves, why is that my goal? What do I think I'm going to be able to change or affect? Because if I'm stuck on something I can't, then I'm just going to get more and more frustrated. And that's super fun when I'm engaging in the strategies that are supposed to help me feel less stressed. And now they make me feel more stressed, right? So doing a check-in on that one. Yes, and let's talk strategies. Like, good, great. So what are we doing about all of this, right? The healthy ways to respond to stress. These are the 4 categories that are represented in that earlier inventory. Again, we have a lot more information if you want to dive into more of this. So check out the webinar from November. This is also the framework that is used in the TeacherWise Wellbeing Workbook and the Provider Wellbeing site. So you can get tons more information there. But in broad categories, healthy alternate activities, just do something else, distract yourself, right? When you're really in that moment of, I've had this horrible meeting at work, I just can't stop replaying it and replaying it and replaying it. Something to distract yourself. Something that you have to think about a little bit, and so you can't be thinking about work. when you're also thinking about this other thing over here. So I like to do things with my hands a lot. I've been working on like staining some bookcases. It's not like I don't have to think super hard, but I have to think enough and concentrate enough on what I'm doing. I can't stay consumed with the other stuff that's been ruminating. Reframing, what is the lesson I can learn here? Is there some way to look at this in a different light? Can I problem solve it? Right? Can I just get out of my feelings and into my thinking and start to problem solve whatever it is that's really causing me issues? And engaging my social support. How much am I reaching out or how much am I withdrawing? Right? So am I talking to folks? Do I have that social support? Are there others at work or in similar places that are going through similar things that we could all talk and have some validation about what we're all going through? All right. There we go. All right. So for my mental health clinicians, you know this triangle very, very well. We use it though because it's helpful and it works. So if you've not seen this triangle before, there's 3 ways to change our feelings, essentially. Feelings, thoughts, and behaviors. There's feelings, thoughts, and behaviors. Each one of these impacts the other 2. So the key here is we can do one of these things to change the other 2 aspects. Which one you decide to start with is just dependent upon personality, choice, what's available to you at the moment, what feels accessible. So if we start with our feelings, right, managing our feelings, we can do things like listening to music, finding a distraction, things that help lift and change our mood. But that's not always the easiest place to start. In fact, I would say it's probably the hardest of the 3. If you've ever had somebody say to you, well, you just shouldn't be upset about that. Like, just don't be upset. It's like, oh, well, that's really, really helpful, right? So not always super helpful. If we can't manage our feelings, we can manage our thoughts. Managing our thoughts will impact the way that we feel about things. So if you are somebody who likes to do meditation, this is a great time to do that. It doesn't have to be full-on meditation. There are strategies to just recognize the thoughts that you're having, redirect those thoughts, just kind of let it move through you. Don't let it get stuck. Positive self-talk is another big, big, big one. Right? When we find ourselves ruminating in our head and really beating ourselves up for, oh, I can't believe I said that to that student, or I didn't handle that parent phone call very well, or I wish I'd done this, I wish I'd done that. Positive self-talk. Right? The stories that we tell ourselves about ourselves are the key to everything. Because if we're beating up on us, where do you go to feel good, right? And we need a little bit of positive in our lives every day. And then managing our actions. Sometimes even my thoughts are hard to manage. I'm just mad. I am really mad about something that went on. But I can always manage my actions. I can get up, I can go for a walk. I can do something physical. I can change my physical space. And that will impact both your thoughts and your feelings. So you pick your entry point. Right? Now, here's some daily-ish practices, right? So some things that we might look at building into our lives just as well-being supports for kind of the day to day. Go for a walk. When we talk about exercise and movement, it doesn't have to be gym membership and all of that kind of stuff. Move, just move. Go for a walk, do some stretching. In fact, I have mindful stretching for just 5 minutes. If you want to do 30 minutes of yoga, awesome. If you don't have 30 minutes to do yoga or the energy to do yoga for 30 minutes, 5 minutes of stretching is just as good. Eating things with high nutritional content. Notice I did not say eating healthy. Right? It's just that you eat something every day that's packed full of vitamins, minerals, nutrients. Writing down 3 positive things from your day. We are programmed to watch for the negative, to watch for the threat, to watch for the thing that we need to worry about. When we're in times of high stress, it's very easy to lean into that. And all we're doing is watching for the negative. So gratitude journals, or writing down 3 positive things from the day every day, helps us attend to, okay, not all of the day was awful, right? There were 3 things today that were good things that I can write down. Not only will it help you have a little more sense of balance about your day, but it also forces us to start looking for them. every day. It's like, oh, I know I'm going to have to write 3 things down. I start attuning to that, and I start watching for moments in my day. I was like, oh, that was actually a really good thing. It's been an awful afternoon, but that was awesome. Connecting with friends, loved ones, neighbors, acquaintances. I think a lot of folks are still rebuilding social networks from times of isolation and separation. So even if it's just a goal to reach out to somebody you haven't talked to in a while, once a week, right? Send one text, one email, one message, one voicemail, but make sure that we're connecting with folks. Saying or writing affirmations to ourselves. We're really, really good at affirming other people. We're not always really good at affirming ourselves. So it's not just attending to our self-talk, but are we saying good things to ourselves about ourselves every day? And then laugh anytime you get the opportunity to laugh. One of the changes I played with is I typically will listen to the news on the way to work. That is something I've had to rethink. When I got access to one of the satellite radios that you can do the different channels, I actually started listening to a comedy channel for a while. And I'd listen to this comedy channel on the way to work and home from work. And it made kind of a big difference in my mood. I was a little surprised at how just laughing a bit, on the way to work and on the way home really changed my mood, both at the beginning and the end of the day. Creating space and boundaries. If nothing else, no work talk time with colleagues, friends, partners. A lot of us I know have good friends through work. And it's really easy when we have friends that we work with or have worked with for our conversation to be all about work. So sometimes we have to have a little more intention in that and say, you know what? We're just not going to let that take over our hangout time together today. We can talk about work for about 10 minutes, and then we've got to talk about other things. Creating routines that help establish a separation of home and work. If anybody's still involved in remote work, that can certainly get challenging. This is where routines can become important. If I can't physically separate my space, can I, even getting down to, can I wear something different, right, in each space or during each time? Can I have strictly work clothes and then work clothes clothes I change out of, even if I'm still within the same room? We have to have signals to ourselves that work is over, right? I can be out of that. I can give myself permission to not think about that. And anything that we can do to reinforce this sense of work and off work is helpful. Establishing boundaries. I think this has always been important in education. We've never been good at it. And it's just really, really critical now that we don't have to check email at 10 o'clock at night or respond to messages at the softball game at 2 o'clock on Sunday afternoon. All of these work-related actions that take up our personal time and really prevent us from being fully engaged in our personal time, you have permission to set those boundaries and say, no, I'm sorry, I will deal with that Monday morning. What else do we have here? Oh yeah, if you can create a workspace, a work-free space at home, and enlisting others to brainstorm, figure out what can we do. This is really helpful in workplaces. Is it your grade level team? Is it a committee that you're on? Is it you and the other school psychologist? I know for a lot of our mental health clinicians, school-based mental health clinicians, and nurses and speech paths, right? We get into this space where it's just the one of us and nobody really understands what our day looks like, right? So whether it's having a group of speech pathologists or a group of school psychologists, what can we do for ourselves that help support us create these boundaries and create some reasonable routines? All right, so the last things I've got for you, we had created these kind of quick reference self-help cards, essentially. There's 2 slides of these. These are designed that you can print them on a single sheet of paper when we're in person. And so you'll see the strategy, the instructions for it, and then when you might want to use it. These are good for both you and folks you might be working with. So we have the breathing strategy. It's the basic breathe in, hold, breathe out. We have progressive muscle relaxation, and we have a grounding exercise. So breathing is really good when you've got racing thoughts and you feel this need to calm your mind. Progressive muscle relaxation is really good if that restlessness is more physical than it is mental. And then if we're just feeling really unfocused and not fully present, right? My head is still over here dealing with all this other stuff. This mindfulness exercise of identifying 5 things you see, 4 things you touch, 3 things you hear, 2 things you can smell, and 1 positive self-statement of encouragement, right? So this is just simply kind of pausing for a moment, right? I can see my desk, the lamp, my phone, my laptop, and my water bottle. I can touch my leg, the windowsill, my mouse, and the speaker. I can hear the water running outside. I can hear the lawnmower, and I can hear the HVAC going. I can smell a candle I have over in the corner and the lotion I just put on. And I'm going to get through today. I know I'm going to get through today because I've gotten through worse. That quick, right? That quick. But it brings you back here. It grounds you to the present and can help us kind of collect ourselves again. Some other ideas, strategies is categories. Pick a category, try to list as many things as you can. Doesn't matter the category, doesn't matter the rules around it. This is part of that distraction, right? I've got that ruminative thought going on and I need to interrupt it. So can I list all the states? How many foods can I think of that begin with the letter S? Whatever it is, right? This is a distraction. Reframing we talked about, you'll see here some guiding questions for negative thinking. What evidence do I have that this negative thought is true? What evidence do I have that this is not true? That's the key, right? Is it going to matter in a year or 5 years? What's a different perspective that I can have? We've talked about engaging our social supports, so calling a friend and going for a walk or just changing our environment. Before we move on from here, we're going to fairly quickly, I know I can't see everybody, but get comfortable-ish, right? If you're sitting in a place, we're going to do just a couple rounds of breathing. There's a bunch of different ways you can do this for ease. I like to do just 5, 5, 5. So we breathe in for 5, we hold for 5, we breathe out for 5. I taught this to kindergartners because we can do it all on our hand. I can count on one hand and then count rounds on the second hand. So, and feel free to turn your cameras off if that's more comfortable. We're all going to inhale together. And we're going to hold that. And we're going to exhale. And again, inhale. And hold. And exhale. And one last round, inhale. And hold. And exhale. And then just take a second. Feel the settling in your body. Right? Just 3 rounds, not even a minute long. Like I feel a little more clear, a little more calm. You can do this for yourself. You can do this with a student in session. You can do this with a classroom. You could do this in a staff meeting, right? Couple rounds, very, very quick. All right. I would love to hear what kinds of things have you tried in your schools to promote self-care or to promote well-being. You can drop those notes in chat. I know we are getting close to time, so we're going to, as you let us know in chat what's going on, I'm going to read you this quote. It is one that I've used a few times. I really like it. This is what helps me with that ruminative, put your day in its place and move on. Okay? Finish each day and be done with it. You have done what you could. Some blunders and absurdities have crept in. Forget them as soon as you can. Tomorrow is a new day, and you shall begin it serenely and with too high a spirit to be encumbered with your old nonsense. Here are some additional resources. We will be posting both the webinar recording and the slides in about a week. It's usually up by Monday or Tuesday the following week. The links to all of the workbooks and worksheets and all the rest of that will be in the slide deck. See, when you start, having a little bit of trouble finding your words. All right, we have some other upcoming webinars on April 11th, promoting family and community empowerment to strengthen positive school climate. On May 9th, we have collaboration between school and community settings, something I think we're seeing a bunch more these days. We do have the, get to it. Yes, we have the evaluation. I know Cameron mentioned this in the beginning. Please do take a second to complete it. It's actually quite helpful for us as a metric and as a way to demonstrate the work that we're doing. Plus, I really appreciate the feedback. I will say I always read the feedback I get and try to incorporate it. Thank you for all of the kind comments. Cameron, do we have any other announcements we need to do at the end here?
No announcements. There are a couple of questions in the Q&A. I don't know if people have taken off.
Yeah, so the first question, well-being and wellness, can these terms be used interchangeably? Yeah, I think we could sort of quibble over wellness being a more general, maybe health inclusive. Well-being tends to be used a little more when we're talking about kind of emotional, psychological. But I really see a lot of this being, even self-care as being thrown in there and used interchangeably with wellness, well-being. And self-care really is just specific to things that we're doing for ourselves. And by the way, I wanted to mention, if you're sitting here thinking, yes, but there's only so much I can do in a really difficult environment, you are 100% correct. And I would offer to you the webinar we did on organizational well-being last week, which you can watch the recording, it is up now. But that is looking at well-being from an organization standpoint and what can our entities do to promote well-being versus putting it all on the individual. The PULA stress inventory is included in both the teacher-wise well-being workbook. Sorry, that was question number 2 that came through. It can be found within that workbook. It can also be found on the provider well-being site. It is also one of the attachments that we'll include in the larger slide deck when we post it. Yeah, and then a question around, it's an excellent question, right? How do we balance productivity and self-care? And when we are being too hard on ourselves, or maybe others feel like we're being too hard on ourselves, and where can we draw the lines, right? Where is it taking care of myself? Where is it irresponsible? Where is it selfish? Where, right? It's a hard line to find often. I think, first of all, the larger perspective of if you were to maintain your current level of stress, could you still be doing this job in 6 months, in 3 months, in a year? If the answer to that is no, then there's some change, right? Then there is some pulling back that should happen, because our jobs shouldn't have a time limit on them simply due to stress, right? That I'm dealing with so much stress. I can't even be effective in my job anymore. And I think, asking some questions around why am I prioritizing this particular thing or this productivity? And if we find ourselves, because it has to be this, it has to be, we can kind of back up a little bit and become a little more comfortable with good enough. Grad school was where I had to learn to embrace good enough. Is it perfect? No. Is it the best thing I've ever done? No. Is it honestly the best thing I'm capable of doing? Probably not. Is it good enough for the purpose it needs to serve? Absolutely. And sometimes that has to be good enough. Feel free to reach out with an email. I know we didn't have a whole lot of time for those questions. All right, we are at 4, a little after 4. Again, thank you so much for joining today. I hope you find the resources helpful. Let us know if there's anything else you need. I'm scrolling through, looking at the ideas. I love these. Thank you.